I'm Sarah Doe, and I'm a nurse practitioner student. I'm going to perform an assessment on different body systems, and for this assignment, it's being recorded for educational purposes. Can you please state your name, your age, and if you are okay being recorded?
I'm Lourdes, I'm 18 and I'm okay with it.
Okay, I'm going to first assess her level of consciousness. She is awake, alert, and appears to be in no acute distress. I'm assessing orientation to person, place, time, and situation. Can you please tell us your full name?
Lourdes Hondo.
Okay, can you tell me where you are right now?
At home.
Okay, what is today's date?
May 5th.
And why are you here today?
For a health assessment.
Okay, thank you. I'm going to assess attention and concentration. Starting at 100, can you please count backwards for using every 7 digits?
193, 86, 79.
Okay, that's good. Her attention and concentration are intact. I'm going to assess her memory. So right now I'm going to give you 3 items and I'm going to ask you about them again in about 5 minutes, okay? So I want you to remember them, and after I say them, I want you to repeat them back to me. Cat, the number 7, and table.
Cat, number 7, table.
Okay. And again, I'll ask you about those in about 5 minutes. I'm assessing abstract thinking. Can you please tell me how an orange and a ball are similar?
They're both round.
Can you please tell me how they are different?
One's a toy and one's a fruit.
Okay. Her abstract thinking is intact. I'm going to do a mental status exam. How would you describe your mood today?
Pretty good.
Okay. And mood is reported as good. Her speech is clear with normal rate and tone. Her thought process is linear and goal directed. I'm observing her affect, which appears to be appropriate and congruent with her stated mood. I'm assessing her thought content. Do you ever feel like people are trying to harm you or that they're watching you?
No.
Okay. Do you have any thoughts of harming yourself or others?
No.
Okay. Do you see or hear things that others don't?
No.
Okay. Do you think that you need any treatment or help for any reason right now?
No.
Okay. So the patient is not suicidal or homicidal and denies delusions or hallucinations. Insight is good. I'm going to assess her judgment. What would you do if you were walking down the road and you found an envelope that was sealed, addressed, and stamped on the ground?
Put it in my box.
Okay. Her judgment is intact. Can you tell me the 3 items that I asked you about earlier?
Cat, the number 7, table.
Okay, good job. Her memory is intact. Neurological exam we're going to work on. So I have already pre-washed my hands and I have got gloves on. I've got my sanitizer that I already used. I'm going to assess your cranial nerves. The first thing I'm going to do is to check your sense of smell. So I'd like you to please close your eyes and block one of your nostrils using your finger. What do you smell?
An alcohol pad.
Okay, and can you do that to the other side, please? Go ahead and tell me what you smell.
An alcohol pad.
Okay, cranial nerve number 1 is intact. So I'm going to check for visual acuity, and there's a Snell chart behind you. If you can just stand up really quick and turn around. If you can please read the smallest line that you can see with one of your eyes closed.
P-E-Z-O-L-C-F-D-T.
Okay, and please cover the other eye and read the smallest line you can see there.
P-E-Z-O-L-C-F-D-T.
Okay, good job. You can have a seat again, please. Visual acuity is 20/20. I'm going to check the visual field. I'm going to stand about this far away from you, and if you can please close your left eye and look at the tip of my nose and tell me when you see my finger, okay?
Do I see your finger?
Okay, from this area down here.
I see it.
Okay, and switch eyes. I'm going to come from up here and tell me when you see my finger.
I see it.
Okay, and I'm going to come from down here. Tell me when you see it.
I see it.
Okay. Her visual field is intact. So I'm going to check for a light reflex. Okay. Okay, there was direct and consensual light reflex present. I'm going to do an H pattern with my finger. If you could please follow it. I'm going to check your eye muscles and see how they move. Okay, extraocular movements are intact. Now I'm going to touch parts of your face with a light swab, cotton swab. Okay, so if you can please close your eyes and tell me when you feel something, okay?
I feel it. Feel it. Feel it. Feel it. Feel it. Feel it.
Okay, good job. I am going to assess your muscles of your chewing muscles for mastication. So I'm going to place both my hands on both sides of your jaw, and then once you feel my teeth, if you could please clench your teeth. Okay. Any pain there?
No.
Okay. All right, next I'm going to check cranial nerve number 7. If you can please look directly at me and smile. Frown. Raise your eyebrows really big. If you can please puff your cheeks out. Okay. And I think that was it. So your facial movements are symmetric, and let's see. I am going to assess your hearing next using this little device. Okay. So I'm going to hit it on my hand, and if you can please just tell me when the sound is equal or louder on one side.
It's equal.
Okay. And can you tell me when you stop hearing the sound?
I stopped.
Okay. Now tell me if you can when you stop hearing it on this ear.
I stopped.
Okay. And tell me when you stop hearing it on this side.
I stopped.
Okay, so there's a positive Rene test. So next I'm going to use a tongue depressor. If you can please open your mouth, I'm going to check for your gag reflex as well as your palate. So if you can, hang on, let me get my pen light. If you can please say ah. Okay. It looks like her gag reflex is intact and her palate rose symmetrically on both sides. So now I'm going to check if you can please raise your shoulders when I push them down. Okay. The next thing that I am going to do, I want you to push against my hand. Okay. And do it again on this side. Okay. If you can please stick your tongue out at me and then move it left and right. Okay. And I believe that with that, we are done with the cranial nerve testing. So I'm going to check your motor function now. Just in assessing her, it looks like her movements appear strong and equal bilaterally. I am going to assess her sensory function in the distal, upper, and lower extremities. So I'm going to use this device. Now what I'm going to do is if you can tell me if you feel sharp or dull when you feel this. Close your eyes.
Sharp. Dull. Sharp. Dull.
Okay, can I see your foot? I'm going to check your foot now.
Sharp. Dull. Dull. Sharp.
Okay. Okay, and then I am going to, I'm also now going to touch basically those same parts with cotton now, and I want you to tell me when you feel them. If you can close your eyes, please.
I can feel it. I can feel it.
Okay, and your foot.
I can feel it. I can feel it.
Okay. Okay, now I'm going to check if you can hold your fingers out. Now close your eyes and tell me which direction am I moving your finger, up or down, okay?
Up. Down. Down. Up.
Okay. Thank you. Okay. Okay, I'm going to use this little tuning fork thing again, and I want you to I'm gonna tap it, and then I'm gonna touch your certain bones, okay? Your hand, wrist, your ankles, and your toes, okay? And when you stop feeling it vibrate, then let me know, okay?
Stopped. Stopped.
Okay, I'm gonna check your ankle down here. Oops, hang on. Okay.
Stopped.
And can I see your other one, please?
Stopped.
Okay. The next thing I'm going to do is check your deep tendon reflexes. I'm going to be assessing different parts. So if you can let me have your arm right here. I'm going to just go ahead and bend your arm. Okay. Next thing I'm going to do is here, let me check this side too. Because what you do to one side, you have to do another. Okay, now I'm going to check the back side. I'm going to hold it this way. Okay. Okay, and the next thing I'm going to check your brachioradialis reflex, if I can have this. Okay. Okay. The next thing I'm going to do is your knee. So if you can just let your legs hang down. Okay. Okay, and the next thing is your Achilles. So I'm going to, if you can pull your foot upwards just like this. Okay, another one. Okay. And then I'm going to do a Babinski. So I'm going to stroke the lateral side of your foot. Okay. Okay. And there appeared to be a normal response. Her toes curled downward. So her deep tendon reflexes are 2+ bilaterally, and I'm going to assess her coordination. So I want you to take your index finger and touch the tip of your nose and then touch my finger. And just keep going back and forth a couple of times. And now switch hands, please. Okay, now I want you to take your heel and rub it down your shin on the opposite side, and then do it to the other side. Okay, now I want you to take your fingers and I want you to go like this with each finger touching your thumb, and do it on the other side too. Okay, and now I want you to take your hands and place them on your thighs and then flip back and forth like a fish out of water. Okay, her coordination is intact. Now we're going to, if you want to move over here to the couch, please, and lay down. Okay, you want to put your head over here? Oh, you know what? Hold on. Sorry. Let's stand up real quick. We're going to do the Romberg test. So what I want you to do is to keep your feet together, please, and keep your arms at your side. And I want you to close your eyes. Okay. Go ahead and close your eyes. If you get dizzy, you can open your eyes. Otherwise, just go ahead and stand there for a few moments. Okay. Romberg test is negative. So the next thing, go ahead and lay down. I'm going to perform an abdominal exam on you. Okay. So go ahead and lay flat on your back, and I'm going to ensure her privacy and expose only the abdomen. Is it okay to show your belly or no?
Yeah.
Okay. Her abdomen is flat, symmetric with normal skin color, no scars or protrusions noted. I am going to first auscultate her abdomen before we do any palpation. We're going to listen in all 4 quadrants for bowel sounds using the diaphragm of the stethoscope. Bowel sounds are present in all 4 quadrants, and it's normal in frequency and in character. So the next thing I'm going to do is to tap on your belly in that same 4 quadrants, but we're going to do percussion, okay? So I was percussing the spleen and the stomach area, and there was tympanic sound in all 4 quadrants. So I'm going to check the liver span now. So let's see. Right back here. Okay, this appears to be the upper border of the liver right here. And then I'm going to go down here. Okay, this is the lower border of the liver right here, and the liver span appears to be within normal limits. So now I'm going to begin the abdominal palpation. So I'm going to first palpate all 4 quadrants superficially. Let me know if you feel any pain there. There's no guarding or tenderness. Now I'm going to do deep palpation on all 4 quadrants. Let me know if there's any pain. There doesn't appear to be any guarding, pain, or masses that are noted. Okay, I'm going to palpate the liver edge, so go ahead and take a deep breath. Okay, the liver edge does not appear to be palpable, and okay, now I'm going to check your spleen, okay? So same thing like the other side, if you can take a deep breath, please. And the spleen does not appear to be palpable either. And based on that, this concludes our health